hypotension is low blood pressure. Around 10% of the population has hypotension chronically. The problem is big because hypotension has a strong correlation with underlying heart disease. That's why we need to detect low blood pressure earliest to prevent further complications. Low blood pressure is considered when the upper measurement systolic pressure is less than 90 millimeters of mercury, or the lower measurement diastolic pressure is less than 60. If we say what types of hypotension exist, there are several main types. Chronic, when a person has constantly low blood pressure. Acute, when blood pressure drops instantly. Orthostatic, which means when a person gets up and blood pressure drops. And fourth is shock related, so low blood pressure because of shock. Also, hypotension after eating is common, which is called postprandial hypotension. It's more common after large meal and in older adults.
After eating, a larger volume of blood flows to the digestive system to aid in digestion. And sometimes the body's compensatory mechanisms may not be sufficient to maintain blood pressure in other areas. If we say what is the most common scenario of low blood pressure, it is orthostatic hypotension, when a person stands up quickly and feels dizzy or faint, and it happens within 3 minutes of standing. It is caused by blood pooling in the leg, which momentarily lowers the amount of blood returning to the heart, consequently lowering blood pressure. The first and most common sign of low blood pressure is dizziness and lightheadedness. The brain is highly sensitive to oxygen deprivation. Less blood means less oxygen in the brain, and it causes dizziness. The second most common sign is fainting, also called syncope. It is an extreme consequence of reduced cerebral blood flow. If a person has syncope, it always requires further medical testing.
Third, the third most common sign is fatigue. Organs and tissues get less blood, including muscles, and it causes a sense of tiredness and weakness. The fourth common sign is nausea. It is not known well why it happens. It is thought that low blood pressure activates the autonomic nervous system, and it activates the vagus nerve, and it can cause a sense of nausea. The fifth common sign is blurred vision resulting from decreased blood flow to the eyes. The eyes, particularly the retina, are also sensitive to blood flow changes. Reduced blood supply to the eyes can affect the function of the retina and optic nerve, leading to temporary blurred or distorted vision. The sixth sign is difficulty concentrating and confusion. It is a direct neurological symptom due to insufficient oxygen supply. When blood pressure is low, cognitive functions like concentration, clear thinking are impaired due to cerebral hypoperfusion. Confusion indicates a more significant level of brain oxygen deprivation.
And the seventh sign is cold, clammy, pale skin. It happens because due to low pressure, the body tries to compensate and divert blood flow from the skin to vital internal organs. It causes less blood towards the skin, and we feel it as cold and pale skin. Now let's say what are the most common causes of hypotension. The most common cause of low blood pressure is dehydration, lack of fluid. For example, in older adults, there is reduced sensation of thirst, or young people who work physically outside, or children who do not interpret accurately the thirst signal. Also, people with illness, with diarrhea and vomiting, commonly lose an important amount of fluid, which causes low blood pressure. The treatment at this case is adequate fluid intake and oral rehydration solutions. The second most common sign of heart diseases, especially heart failure and arrhythmias, is hypotension. Around 30% of hypotensions are caused by heart problems. This is more common among middle-aged to older adults, particularly those with a history of coronary artery disease or previous cardiac events.
If we say the most common heart problem associated with hypotension, it is definitely heart failure. Around 60% of heart-related hypotension cases, and among arrhythmias, atrial fibrillation is the most common cause of hypotension. Also, bradyarrhythmias and heart valve problems are also an important cause of arrhythmias. Electrocardiogram and echocardiography is used to assess heart function or arrhythmias. Both heart failure and arrhythmias require treatment. The third most common cause of hypotension is medications, especially blood pressure medications, beta blockers, ACE inhibitors, and diuretics that can lead to hypotension. In elderly populations, medications are implicated in up to 30% of hypotensive episodes due to polypharmacy and altered drug metabolism. The treatment at this case is 3. Assess the patient's medication, adjust dosages, or switch to alternatives if possible. The fourth most common cause of hypotension is endocrine problems. For example, hypothyroidism and underactive thyroid gland slows down processes in the body, including heart function, and causes hypotension.
Even hyperthyroidism can cause hypotension, especially with treatment. Addison's disease, when reduced cortisol production in the adrenal gland, causes hypotension, fluid loss, and vasodilation. And hypoglycemia, when low blood sugar level, even if a person has a low normal range of glucose. For example, 70-60, they still can experience lightheadedness and dizziness, and it is associated with hypoglycemia. Fasting also can cause hypotension due to fluid loss, dehydration, and low sodium intake. Sometimes some people naturally have lower blood pressure without any underlying disease. If they're asymptomatic, meaning they don't experience dizziness, fatigue, or fainting, this low blood pressure is simply their normal baseline. Especially athletes with trained people, due to efficient cardiovascular systems and greater stroke volumes, athletes often exhibit lower resting blood pressure. Also, in cases such as early pregnancy or when someone is in a relaxed, well-hydrated state, lower blood pressure can be normal. It's important to consider how the person feels and whether there are any signs of organ dysfunction.